Hey everyone, we're talking about something so important today. What happens if you miss your enrollment window? Calvin, can you imagine?
Yes.
Getting ready to go on to Medicare, and there's so many different enrollment periods. There's open enrollment at the end of the year. There's something called special enrollment.
Yeah.
What happens if you miss one of these?
I can imagine this because unfortunately it's a mistake that I've seen a lot of people make. I know you've seen a lot of people make the same mistake, and it's really unfortunate because it carries a lot of weight, it has penalties and what have you. But let's just talk first about your enrollment to Medicare because that carries the most weight and probably the most penalties.
Sounds good. What are some important things that we need to know? We're getting ready to go on to Medicare for the first time. What comes top of mind?
Well, first thing you need to know, should I take Medicare right now or not? If you're not sure, then you need to consult with someone to figure out, should you be taking Medicare? But let's assume that you've already determined that and you say, well, I'm 65, I know I'm gonna get Medicare at 65, so everything's good, right? Well, not necessarily, because if you haven't taken Social Security, and this is where I've seen people make this mistake, you will not automatically be enrolled in Medicare. Social Security doesn't have you ready to go enrolled. And by the way, Social Security is who does the enrollment for Medicare. Right. It's not actually done by Medicare. You don't call Medicare to enroll in Medicare, which is a funny thing. You enroll through Social Security. So if you haven't taken Social Security and you don't get automatically enrolled, you could miss your enrollment window. And if you miss that window, then there's problems later.
We go to Social Security to enroll in Medicare. We don't call Medicare directly. We don't go into a Medicare office. There's no such thing. We actually go to Social Security, and we can do that a couple ways. It seems the easiest way for most people is to do it online. We can also call, and we can go in person. So we have a few options. Some local Social Security offices are easier to navigate than others. Typically, when we're helping people with this process, we're advising them to go online. If somebody is working beyond the age of 65, so imagine someone is 75 years old and they're getting ready to go on to Medicare for the first time, we now have to prove that they've had employer coverage for the past 10 years in that example, so that they're not penalized by Medicare. So now there's extra documentation that's required. In many cases, they need to have somebody in the HR department actually sign off that they've had an employer plan in place that they're submitting with their application to Social Security.
What are the penalties associated? We have this enrollment window. When you're turning 65, you have time to enroll in Medicare. You have 3 months before your birthday, the month of your birthday, and 3 months after your birthday. That's that 7-month window. If your birthday is in the middle of the month, let's say that your birthday is in the middle of July, then your Medicare is supposed to start on July 1st. But if your birthday is on July 1st, it's supposed to start June 1st. Right. So 3 months before the month of your birthday and 3 months after, you have this enrollment window. If you missed that because you thought you were going to automatically be enrolled, you haven't taken Social Security, and so you're waiting until your full retirement age to do that, you miss your window, now you're going to start to accrue a penalty. And the penalty for Medicare Part B is 10% of whatever the Part B premium is per year that you weren't enrolled. So if you miss a year, you're gonna pay 10% more than everyone else. For how long?
It's a lifetime penalty.
For your entire life.
Go away.
It never goes away.
I've never, ever seen somebody successfully get this repealed, unless they truly had some sort of coverage. Again, if they have creditable coverage and they delayed enrolling, so the most common version of that would be employer coverage, that will ensure they don't have the penalty.
And there are other coverages too. You might have coverage through your spouse's work, it might be through your work, it could be some other coverage that the government says is creditable, but you have to have some coverage or else you will get penalized.
That's why it's so crucial that when you're getting ready to go onto Medicare, or even if you're still working and you don't think you're ever going to go onto Medicare, you're going to keep that employer plan, that you just make sure everything is in the right order so that you're not potentially faced with this lifetime penalty.
I've seen that too. I've seen people that had to go back and prove to Medicare that they had other coverage, but if you don't have coverage, there really isn't a case for you to stand on. You're going to get this penalty. And right now, for most people, they're paying $185 a month for Medicare. And so 10% more means $18.50 additional per month for the rest of your life. And we've seen Medicare Part B costs increasing. Right. Now, if you have higher income, it could be even more painful. You could be paying as much if you're on the highest income bracket. We talk a lot about IRMA, you know, the mean lady at Medicare. IRMA is your income-related monthly adjustment amount, which means if your income is higher, you pay more for Medicare. You could pay as much as $628.90 a month for one person to be on Medicare if you're at that highest income bracket. Well, add 10% on that, and now we're talking almost $63 extra a month. Right. So, you know, on the low end, $18.50, on the high end, $63 extra per month for the rest of your life. And if you go 2 years without, now it's a 20% penalty. 3 years without, a 30% penalty. So the penalty increases every year, and it's just a mistake you don't want to make.
And is that the only penalty?
No, that's not the only penalty.
Not the only one.
That's not the only penalty. So we should talk about another penalty, which is not having prescription drug coverage. And so if you miss your enrollment window for prescription drug coverage, now this is a different window than that when you first enroll. When you first enroll, you need to get, for Medicare, you need to enroll in the right time. And if you don't, you'll get a Part B penalty. The next penalty is the Medicare Part D penalty. That's for people who enrolled in A and B. So you enrolled in Medicare Part A and B, and you did the right thing, but you didn't get drug coverage. And if you don't get drug coverage, then you start to accrue a penalty there too.
Right.
And this penalty can also be very painful. And it's based on the cost of a drug plan, and it also increases every year. Okay, let's talk about the scenario where you missed the enrollment window. You went past the 7 months, you know you're accruing a penalty, it's the 8th month. What do? Do you just call Social Security and say, okay, I'm going to enroll now?
Doesn't quite work that way. You have to wait for something known as general enrollment period, which is January through March. If you're in the middle of the summer, you have to actually wait until the next year in January to enroll. You can enroll then for the first of the next month. It used to be you had to wait months until you could actually have this become effective, but now it's the first of the next month.
So let me recap this so that everyone understands. If you missed your enrollment window for Medicare Part B, it's the 8th month, you say, okay, Medicare, I want to enroll because I missed it. They say, no, you have to wait until January. And on January 1st, you could enroll and potentially have a start date then of February 1st.
Right.
So it's this long wait. Let's say it was April 1st. It's like a bad April Fool's joke.
Yeah.
April 1st, you realized you missed your general enrollment period. You might have to wait all the way until January the next year for a February 1st start date. So it's almost a 12-month wait.
Can you imagine being left without coverage all those months? We just want to make sure that nobody ends up in that situation. It's a very scary situation to be in. It's bad enough to have the lifetime penalties. It's on a whole nother level to be left without insurance coverage and potentially face massive financial exposure.
Yeah, so during those months when you have no coverage and you can't enroll in Medicare, God forbid, knock on wood, you have a heart attack and you have to go to the hospital, you're responsible for 100%. Medicare is not covering you. Even though you're Medicare age, you are not enrolled in Medicare.
Right.
So that's like the worst case scenario. You don't want to miss your window because of penalties, but bigger than that, you don't want to be without coverage. Now, if you missed your window, and if we're talking to someone who's watching this saying, oh my goodness, I have made that mistake, there are things we can do to help you. If you have no Medicare and you weren't able to enroll in Medicare, we can help you enroll in an Affordable Care Act plan, or you could talk to a local insurance agent in your area, and you could enroll in an Affordable Care Act or an Obamacare plan. There are options. But they can be very expensive and they're not as comprehensive as Medicare. So if you missed it, don't go without coverage. You can get coverage, but understand that it's probably going to cost you a lot.
Absolutely right. At least that way you have some coverage.
So we've talked a lot about the enrollment to Medicare and the enrollment window there. But let's say that now that you've completed your enrollment to Medicare, guess what? That's the first enrollment window. A new enrollment window opens for you to enroll in your prescription drug plan or your Medicare Advantage plan or your Medicare supplement plan. And those are 3 separate distinct things. The one we need to focus on is the prescription drug plan. The interesting thing with Medicare, I tell people this all the time, it's kind of like buying a car. You buy a car, you say, okay, I've got my car payment. Well, that's not all. You're required now to get insurance to cover your car. And some people don't realize when you go on Medicare, you're required now to get coverage for your prescription drugs, and that comes from an insurance company. So it's the same scenario. You're required to get extra insurance. If you don't get that prescription drug plan, then you're in trouble. And we've had people over the years say, well, I'll just, call Medicare and sign up for a prescription drug plan. I want the Medicare one. I want the one that comes from the government. Well, there isn't one. There isn't a prescription drug plan that comes from the government. It only comes from insurance companies, and it's a really important window to not miss. So let's talk about that window.
Right, absolutely. If you don't have prescription drug coverage, every month that you're left uncovered, Medicare starts to count those months, and you will accrue a lifetime penalty based on the number of months that you don't have prescription drug coverage. Fortunately, this penalty is not as high as the Medicare Part B penalty, but it still is a nuisance and it will still build up over time.
I think one of the important things to understand about both of these penalties is that they're variable. You look at them and say, well, you know what, not too bad today, but guess what? It's going to go up. It's going to grow for the rest of your life because it's based on the national average premium for a prescription drug plan. And right now that's $46.50. For every month that you go without drug coverage when you should have had it, you will pay an extra 46.5 cents for every month that you went without coverage. So that means that 1 year without prescription drug coverage when you were supposed to have it is going to cost you right now $5.58 extra per month. So you look at that and say, okay, well, that's not too bad. An extra $5.58 per month for 1 year without coverage. We've seen people that have gone 10 years without coverage because they said, oh, I'm helping save the government money. I didn't hurt them. They shouldn't hurt me, but that's not how it works. Everyone has to be a part of the system,
right,
and they're forcing that. And if you didn't participate, then you pay this penalty. When I started helping people 15 years ago, it was like $2.85 a month.
Right.
And it has more than doubled since then.
There's some things that come to mind when I think about this. Again, a reminder, if you have credible coverage, so you have a large employer plan in place, whether it's for you or you're the spouse of somebody that is an active employee, you're not going to have this penalty. You'll prove to Medicare that you had coverage, you don't get this penalty. If you're a veteran, you go to the VA, you don't have this penalty. People that just go to the VA, there are still great options for them, and they should consider maybe taking a Medicare plan. There's actually Medicare plans for veterans. That can be a very interesting conversation to have and could potentially be advantageous. But if you have creditable coverage in place, you're not going to face these penalties.
So let's take a minute and just talk about, why does this happen? I mean, I've seen many scenarios like this where people have gotten themselves in a situation with a penalty, and I have my opinion on how that happens, but like, what has been your experience?
What I've seen in most cases is people are just getting bad information from those individuals in their lives that are trying to look out for them. It's their HR department, it's their family and friends, it's a neighbor. They're telling them something incorrectly. They don't mean to. They're not trying to do any harm. But it's just so nuanced, it's so complicated that they're just getting bad advice.
So it's bad information from good people.
Yes. Bad information from loving people.
From loving people. Bad information from loving people. I have seen the scenario many times where people have said to me, well, you know, I was talking to my neighbor and he said, sign up for this plan. And it's just bad way to make a decision, because there's so many options and so many variables. Two people shouldn't necessarily have the same thing. In many cases, we help a husband and a wife, and the husband will be on one plan and the wife will be on a completely different plan, because every scenario is different.
If you think about it, everyone views health differently. They view risk differently. They view finances differently. And so we have a different perspective on what's the right option for us. And it should be our decision. We should be the ones that own that decision as the ones taking the plan and feel comfortable with that decision. And that's why, especially as you approach Medicare age, just ask the questions, take a look, and really dig in and get multiple opinions and multiple perspectives to make sure that you're not making any big mistakes.
So what advice should we give to people who may have found themselves in this situation where they have a Part D or a Part B penalty?
If you're in a situation where you already have a penalty, first of all, let's make sure it's not a mistake. Did you actually have creditable coverage and Medicare wasn't informed, and we need to inform them that you had creditable coverage? If it's not a mistake, it may change how you look at the plan options available to you. You may need to take a plan that helps to lower your overall costs and reduce some of what you're paying to make sure that your monthly expenses are not too much.
Yeah, I think so too. And I would tell people that you need to seek out someone who can give you good advice, because there are a lot of nuance to all of this. And sometimes there are solutions. I've had people call me and say, I'm getting this massive penalty from the government. It's hundreds of dollars a month. And I realized, oh, that's the income-related monthly adjustment because you have higher income. There are ways that we can try to address that and improve that for you. Or they've said, you know, I've got my prescription drug plan and it ended up being $10 a month more than what they said. Well, can we find that you had creditable coverage? Can we look for ways? So get advice from someone who knows what they're doing. But at the end of the day, you may have to pay those penalties now for the rest of your life. Having said that, for those people who are new to Medicare or getting started, then all the same rules apply. Make sure you're getting good advice, but avoid these mistakes, and then you won't be in the situation where you're paying those penalties.
Right. It's one of the reasons why with our plan fit agents, they follow a process, because there's so much to remember. There's so much to know that they follow step 1, step 2, step 3, step 4, step 5. So they go through a process and they look at all these different things to make sure that nothing falls through the cracks.
Yeah, very good. That's it for today. Thank you for watching. Hopefully it's answered some of your questions. If you need more information about this or other Medicare topics, then please consider liking and subscribing, because we're releasing new informational videos about Medicare all the time.